Our next speaker is nothing short of inspirational. Dr. Kate Granger, in July 2011, aged just 29 years old, got the dreadful diagnosis of terminal cancer. Now, it was a ghastly time, of course, for her and her husband. And for a while, she went through all of those very painful treatments that people have to go through, but they didn't work in Kate's case. And so she made the decision that, for her, enough was enough, and she was going to go back to work as a registrar in Wakefield. But while she was working, she also kept a very moving, very candid, and sometimes very funny, I have to say, diary of what it was like to be on the other side. And the thing that I made a complete pig's ear of a bit earlier, hello, my name is Anita, and I have a terrible memory for things. But what Kate did was a really simple thing, which is every doctor who comes to see you, really the least they could do is just say, hello, my name is. And it immediately breaks down barriers, which are, those little indignities that Tim was talking about. There is nothing worse, I think, than being treated like a piece of meat by somebody who clearly doesn't see you as a human being. And for them to have to introduce themselves to you, they immediately have to be a human being to you. She's an extraordinary woman. I'm delighted that she's here with us today. Please welcome Dr. Kate Granger.
Thank you for that very kind introduction. Hello, my name's Kate. Those 4 words have become very important and very magical in the last year or so, and I'm going to tell you a little bit about that story. But before I do, I just want everyone to use this time and space to reflect on what it's like to be in my position and kind of take away some of those issues when you go back to work on Monday. This was me. I'm 29 years old. I'm happily married to my husband, Chris. I've got a very successful career as an elderly medicine registrar. I'm just 2 years away from my lifelong ambition of becoming a consultant in medicine for older people. Chris and I are just starting to plan a family, and we've got a lovely home in Wakefield. And as you can see, we're enjoying a well-deserved holiday on the Californian coastline. The weather's perfect, and you'd think I had an idyllic life. 2 days after that photo was taken, I was admitted to hospital in the States, acutely unwell. And the reason for my sudden illness was that I had kidney failure. And the reason for that was that my abdomen and my pelvis were full of tumours. Bang, out of the blue, age 29, I had cancer. They patched me up in the States enough to get me home. And then I returned to the UK and the NHS to pursue further investigations and treatments. After numerous painful procedures and further scans, it was determined that I had a very rare and aggressive form of sarcoma. It's called the desmoplastic small round cell tumour, and this is my actual histopathology slide. Unfortunately, the cancer had spread to my liver and my bones, and I was therefore in an incurable palliative situation. I underwent 5 rounds of intensive palliative chemotherapy, which were complicated by serious infections, bleeding, and other complications. And on New Year's Eve 2011, I made a big decision. Chris and I celebrated that day, 10 years being together as a couple. We did that in hospital. The nurses made it very nice for us. We had a table, a dinner, some music, dimmed lights, and I even had a glass of wine, probably against the hospital rules. But when Chris went home later that evening, I had a blood transfusion. And as that blood dripped into my poor, ravaged body, I looked out of the Leeds city skyline and watched the fireworks go off. And I made a decision that I'd had enough, really, and the burden of treatment was starting to outweigh the benefit, so I decided to stop. 3 weeks later, I was back on the wards doing what I love to do, which is look after older people. I wanted to do that job since I was a little girl. There then followed an unexpected period of stability. I was well for about 20 months, which is really an unexpected effect of treatment because my cancer has a dismal prognosis. Most people are dead within 14 months. But unfortunately, in October this year, my cancer started to progress again and I became very unwell very quickly. And I had to make the heart-wrenching decision of whether I went back to chemotherapy or left it there and did my dying at that point. My oncologist told me at that point that I had probably 8 weeks to live, although I'm not sure how he determined that. I decided, as you can see, to have the chemotherapy and went through another 4 rounds. It was tough again. I had some very serious infections. So, as you can see from my story, I've been through every type of healthcare, really. I've had interactions with primary care, I've had operative interventions, I've been looked after on gynecology, urology and oncology wards. So I've got a lot of experience as a patient now, mixed in with my experiences as a doctor. What I thought I'd do with my time today is perhaps tell you about some of my core values as a clinician and a patient, and why those are important to me, and tell you some stories about my experiences and why those core values have emerged in my thinking. And my first core value is communication. Everyone bands around communication being important, but I've really seen what harm bad communication can do as a patient. So if you can, try and put yourself in my position. I'm 29 years old. I know I've got cancer. I think it's confined to my abdomen, so I'm probably expecting to have an operation, then maybe some chemotherapy, and possibly a cure. I'm in a side room in an admission ward. I can hear everything that's going on outside because I'm right by the nurses' station. I'm in pain. I'm alone. And a junior doctor comes to see me to talk to me about the results of my MRI scan that I'd had earlier in the week. I'd never met this doctor before. He came into my room. He did do, "Hello, my name is." He sat down in the chair next to me and looked away from me. And without any warning shot or checking my baseline understanding or asking if I wanted anybody with me, he just said to me simply, "Your cancer has spread." He then couldn't leave the room quick enough, and I was left in a deep psychological distress, with the nurses not knowing what he'd told me, and I never saw him again. I think I'm a little bit, wouldn't like to admit, but a little bit psychologically scarred by that experience. We break bad news in the NHS every single day. It's going on as we speak. But how we do that, we really need to think about what's left with that patient and how they have to live that story. On the converse side, when my oncologist told me my final diagnosis, I had a much better experience. I'd got to know him over the few preceding weeks. He'd asked me if I wanted somebody with me at that point. I didn't. He gently sat down beside me, actually on my hospital bed against the rules, held my hand and gently told me my diagnosis. He then sat in silence and let me take that in and the eventual emotional breakdown that followed. That experience, although probably more devastating news, wasn't as distressing for me as the first experience. My second core value as a clinician, if anyone's heard me speak before, is about the little things. I really think the little things matter when you're a patient, and they're what can make the difference between a good experience and a bad experience. When I say the little things, I mean somebody holding your hand. I mean somebody introducing themselves. I mean somebody sitting down next to you instead of standing over you. I mean somebody taking that extra moment to really listen to your fears and anxieties. I was very sick a couple of months ago, probably the sickest I've been on my journey, and it was a Saturday night, and the on-call oncologist came to see me. And beside all the other things that he did for me, including phoning the on-call urologist, and talking to the radiology doctors, talking to the microbiology doctors, changing all my treatments round, the one thing he did was kneel down beside my bed, put his hand on my arm gently and say, "Kate, you're going to be okay." Because he'd recognised how frightened and vulnerable I was feeling in that situation. A few days later in that admission, a registrar came to see me, and she wanted to talk to me about the positive blood culture results that I'd just received. This was very scary for me to have a bacteremia. And she refused to sit down when I asked her to take a seat in the chair that was right next to my bed. She thought that I was asking her for her own benefit, but I wasn't. I was asking for my benefit so that we could have a conversation on the same level. Instead, she stood looming over me, making me feel little and less in control. Those little things do really matter, and everyone can do them. My third key value is that person-centred care. This is a phrase that's bandied around the NHS and NHS management and leadership all the time, but what does it really mean? In January, I was admitted to hospital with febrile neutropenia. At that time, I was put on the standard antibiotic protocol, given some intravenous fluids, reviewed by the consultant and transferred to another ward. On that ward, a nurse came to give me my antibiotics at lunchtime. The antibiotics had been changed from the standard protocol, which is a drug called Tazocin, to something called meropenem, which is used for much more serious infections. I didn't know anything about this change in antibiotics. The first thought that went through my head was, has she got the right drug chart, or has somebody made a prescribing error? The second, more worrying thought that went through my mind is, oh gosh, they've got the meropenem out. They need to use a domestos. I must have something really serious. Looking back through the medical notes, what had happened was the consultant oncologist had reviewed me. He'd been very diligent and looked at all my microbiology results on the computer. He'd found that I'd grown a multi-resistant E. coli from my urine a couple of weeks earlier, and correctly asked the junior doctor to phone a microbiologist for some advice about this. The junior doctor had done the tasks that she'd been asked to do. She phoned the microbiologist, clearly documented in the medical notes what they said, and changed my antibiotics appropriately. That was an episode of safe care. I received the right treatment in a timely fashion. However, it forgot one thing, and perhaps the most important thing, which is me. And I think if it could be written in big, bold letters across my medical notes, then anybody who knows me is that I want to know absolutely everything. So this was a serious change in treatment that had been forgotten to tell me. And I think that's something that happens. I've done it as a junior doctor, I'll admit it on this stage, that you tick your jobs list and you get so ingrained in that you've got all these jobs to do when you get stuck in this system that you forget the patient. For my first job, I worked in Dewsbury Hospital, and I worked for a doctor called Dr. Kemp. He was a diabetologist and a very wise physician coming towards the end of his career. He took me under his wing as he knew that I wanted to become a physician. And he said to me one day, Kate, Being a physician is about painting a picture. It's not about ticking a box or following a protocol. And during an admission, you'll fill in extra bits of the picture every day until you've got a full painting. I think that kind of relates to William Osler, who said the same thing many, many years ago. And that links to my fourth key value, which is about seeing me, not just my disease. I've been referred to within earshot by several consultants as that girl with DSRCT. Within one sentence, I've been reduced to just somebody with a rare cancer and nothing else. At a vulnerable time in my life when I was feeling pretty low emotionally anyway, that's not something that I want to hear. I'm much more than just a rare cancer. I'm a wife, a daughter, an auntie to a new baby in a few months. I like to play the flute. I'm an avid baker. There's lots and lots of things about me that are more important. And this has become something that's very important to me in my clinical practice now I've returned to work since being diagnosed with cancer. I want to know more about my patients so that I can contextualise their disease within their own lives. And that's extremely important for what I do as an elderly physician. People have got loads of stories to tell you about their lives. I've looked after a gentleman who was an Olympic cycler in his day, and people had written him off as being, too frail to do any more treatment for. But actually, if you asked about this gentleman, he'd been walking up mountains the week before he got ill with his pneumonia. So I fought for his ICU admission and he got better and left hospital. I sent this tweet a few months ago when I was on a urology ward, and people everyone from the housekeeper, healthcare assistant, nurse, kept referring to me as bed 7. It was even bed 7, what would you like to drink? My name is Kate. I think I've established that today. Coming into hospital is an extremely dehumanising experience. You really do leave your personality and humanity at the doorstep, and sometimes even your dignity. At least having your name is one thing that we can do to help humanise this experience and not number people. This is a hospital selfie. I took this picture because I was feeling very tired and very distressed, and I thought I would want to show the world what I was feeling like at that time. I'd been in hospital for 3 days, and I'd been through the routine of hospital, which anyone who's been in the audience will understand. 2 a.m. OBS, 4 a.m. change your intravenous fluids, 6 a.m. OBS again, 6:30 a.m. just as you're getting back to sleep, antibiotics, 8 o'clock OBS, and so it goes on every night. By day 3, I was becoming extremely sleep deprived, and anyone who knows me, I get very ratty when I'm sleep deprived. And I just wanted to rest. That's all I wanted to do. I just wanted to sleep. I'd been very unwell. And so the interruption started. A phlebotomist woke me up to take my blood, but I'd already had my blood taken from my portacath earlier that morning. Then a healthcare assistant came to change my bed. Could that not wait just a few hours while I catch up on my sleep? Then somebody came to offer me a tea or coffee. I've been on this ward multiple times. I don't drink tea and coffee. The straw that broke the camel's back was the cleaner who literally yelled at me until I was awake to ask if he could clean my room. At that point, I pulled the sheet over my head, turned my back on the world, and just wanted to forget where I was. I self-discharged it later that day, probably against medical advice, but I went home, had 16 hours sleep, and felt a lot better for it. I'm going to tell you the story of Hello, My Name Is Now. In August, I was having a routine operation to replace a stent that drained my kidneys. That surgery was uncomplicated, and I have a surgeon that I very trust in. He's an amazing man. I went home 4 hours after I'd woken up from my anaesthetic. As soon as I'd had my final set of obs, I was out at the door. Unfortunately, 36 hours later, I was back in the emergency department with a high fever and a low blood pressure with a serious post-op infection. I was triaged by a nurse that I'd worked with in the past and was lovely to me. And then things started to slide. I was clerked in by a surgical doctor who had no name and no role until I asked him, and seemed a little bit put out that I wanted to know what grade of doctor he was and what his name was. Then I assume a healthcare assistant or a clinical support worker came to cannulate me and take my bloods. She had no name. Then a nurse came to give me my antibiotics. She had no name either. And finally, somebody introduced themselves to me, and that was a porter. And this porter was called Brian. Brian was a little star. He helped me get onto his trolley. He fetched extra pillows and blankets. He noticed that I was in pain and took extra care to push me over the bumps in the corridor. And all the time he was talking reassuringly to my husband and me. He was exhibiting the little things, and in doing so, relieved so many anxieties. There then followed a week-long admission to a surgical ward, where the lack of introductions seemed to permeate through every professional group and all the support staff. When somebody did introduce themselves, it made such a difference. You knew which nurse to ask for. It started a human connection. So one evening during visiting time, I decided, I was moaning to my husband about this. And Chris is a logistics manager for a big supermarket, a very practical person. So he said to me, "Stop whinging about it, Kate, and do something." And the result of that conversation was #HelloMyNameIs. This is a social media campaign that encourages everybody who has any facing patient role to introduce themselves to their patients. I believe it's much more than common courtesy. I believe it's about a human connection. It's about beginning a therapeutic relationship, about building trust and rapport. And as a patient, you are really at the bottom of the pile in the power stakes. As a healthcare professional, you know so much detailed knowledge about the people you're looking after. And one way of rebalancing those scales of power is by introducing yourself, asking what a patient would like to be called, explaining what you're going to do. Those really important little things that take no time and cost no money. I wrote a blog about my experiences and invited people to pledge their support, a la NHS Change Day style. And soon we had hundreds of people getting involved in the campaign and tweeting about it. It became clear that my experience was not unique, and people were having the same experience throughout health and social care. I wrote for several journals and was interviewed for several healthcare magazines. And all of a sudden, I had a social movement on my hands. People took this to heart. It seemed to strike a chord. There were posters, there were ward introduction boards, there were lanyards, there were simple reminders in the workplace, there were screensavers. It began to permeate through healthcare conferences, there were selfie campaigns, you name it, people have done it. The government have heard of it as well. If you turn to page 36 of the Department of Health's response to the Francis inquiry, you'll find a box all about Hello, My Name Is. Jeremy Hunt himself mentioned it in a speech about continuity of care for patients and treating people as patients as people. He didn't actually ask for my advice to use the idea, but never mind. We presented it at the Expo in March. I took it to Paris, to the International Forum there, and I had a poster campaign there and did a little talk. I indoctrinated one of my healthcare heroes, Don Berwick, with a sticker. And it's had, if you look at the social media analytics, a massive impact already. I've only been running this movement for 10 months now. And if you look at Simpler, there's been over 26 million Twitter impressions. 15,000 people have tweeted about this, and those numbers go up every single day. I'm asked to talk all the time. I had 3 invitations yesterday. I'm having to learn to say no. I want to take my idea on tour. I think hearing my experiences is a powerful way of engaging with healthcare staff. I would love one of my legacies to be an NHS that considers patients as people and really considers the whole person. I only probably have a few months to live, but I'm determined to use some of this energy and time in a productive way to change and really improve the quality of the care that we deliver in the NHS. I have a bucket list. And on my bucket list, I got to meet Michelle Roux, who's a lovely man. And I just thought I'd finish with that picture. But no talk of mine would be complete without a little plug for my books. All the proceeds go to the Yorkshire Cancer Centre, which is a fabulous charity that really directly improves the quality of life for patients. I know this because I've been on the receiving end of what their funds do. So if you haven't read them, then have a little read. Thank you very much for listening.